Sure. Hi, everyone. Once again, my name is Jill. I am the educator for the Respiratory Care Department over at Valley Hospital, and I'm also a tobacco treatment specialist. So, today we're going to talk a little bit about asthma and COPD, which is also known as chronic obstructive pulmonary disease. And both of these illnesses are common conditions as people age. So, did you know we take on average 30,000 breaths every single day? And each one of these breaths are critical for our survival. The lungs' main function is to help transfer oxygen from the air we breathe into the cells. The cells then carry the oxygen throughout the body, which helps our body to function properly. The lungs help the body get rid of carbon dioxide or CO2 gas when we exhale or breathe out. And this is so imperative in order to avoid too much CO2 buildup, creating a toxic environment. The lungs will be the first organ to suffer should there be a shortage of oxygen. Now, problems affecting your respiratory health can lead to difficulty breathing. This can seriously limit your ability to perform everyday activities and enjoy doing the things you love to do. A healthy respiratory system and unlabored breathing are crucial to healthy living and also quality of life. It is important to understand that respiratory problems are not a normal or acceptable part of getting older. So today, we're going to talk about asthma and COPD, two lung diseases, and ways to function with these processes. So the first disease we will talk about is asthma, and this is known as a chronic lifetime disease that makes your lungs very sensitive and hard to breathe. It occurs in both children and adults, and asthma causes narrowing of the airways inside your lungs. The lungs actually become inflamed and constricted, causing shortness of breath, wheezing, and coughing. The muscles around the airways tighten, creating what is called a bronchospasm, and you see a lot of thick, copious mucus production that can sometimes be seen with individuals that have asthma. This creates further blockage of airflow into and out of your lungs. If we look at the picture number one, it depicts a person who does not have asthma. And then if you look at the second picture number two, this is a person that's experiencing an asthma or an asthma attack. As you can see, the airways become extremely narrow due to muscle constriction, also known as bronchospasms, swelling of the inner lining, and a lot of mucus production. This causes very limited airflow, and during asthma or asthma attacks, the airways become extremely narrow, compromising airflow and leading to unexpected fatalities. Now, asthma affects roughly 25 million people. It affects people of all ages, like I said. It is more prevalent in females than in males. And as you can see from the graph, it affects 5.8% of children and 8.4% of adults. There are 7 risk factors associated with asthma. Family history is one of them. And regarding family history, if your mother or father has asthma, the child is 3 to 6 times more likely to develop asthma than someone who does not have a parent with asthma. Also, viral infections. So, some individuals who experience infections during early infancy or childhood can develop chronic asthma. Allergies is another one, and if you have history of allergic reactions or conditions, the airways in your lungs are so sensitive to various substances such as dust, chemicals, fumes, pollen, as well as tobacco smoke. So all of these substances can cause one to develop asthma as well. Also, obesity in children and adults creates a greater risk for developing this disease. So whether you have a respiratory disorder or not, it's so important to avoid exposure, especially constant or long-term exposure to air pollutants. Air pollution doesn't just occur outdoors. Sometimes there's indoor air pollution that can be just as bad. So some of the sources of indoor air pollution could be biological, such as mold, mildew, dust, gas sources, carbon monoxide, radon, and chemical sources, such as your common household cleaners, bleach, paints, etc. It's important to avoid exposure to pollutants that can damage your lungs. And again, this is because your lungs are so sensitive. So this slide lists various symptoms an individual may experience when they have asthma. We have difficulty breathing, troublesome cough, particularly at night. The patient could cough with mucus or phlegm production. They could have a cough or wheeze and chest tightness, and also breathing problems during a particular season. So in order to diagnose one with asthma, the doctor may ask for family history as well as medical history, which should include family members with asthma, allergies, smoking, and exposure to secondhand smoke. You will also be asked to perform a lung function test known as spirometry. So this test will help determine how well your lungs work. And after taking the lung test measurements, your doctor may ask you to inhale what's a medication called albuterol, an inhaler used to treat asthma to open the airway passages. And then you're going to repeat the test again to see if after you take the medication that you show signs of improvement. Knowing your asthma triggers are very important as well. Everyone reacts differently to these triggers when they have asthma. So these are just some of the most common triggers associated with asthma. You have tobacco smoked, outdoor air pollution, pets, mold, cleaning and disinfection products. So how do we manage asthma? And there's something called an asthma action plan, and this is a written plan that summarizes the physician's instructions for self-management of asthma. This plan includes medications, something called peak flow numbers, which we'll discuss, also asthma triggers, as well as actions to take in case you get a sudden asthma attack or during an emergency. So this is a tool that asthmatic patients can use to help outline the steps to take and recognize when experiencing an asthma attack. And it looks something like this. But the main goals is that you want to maintain control of your symptoms. You want a normal activity levels. So you still want to exercise. You want to maintain pulmonary function as close to normal as possible. You want to try to prevent asthma exacerbations, worsening of asthma, and asthma mortality. So now we're going to discuss the second topic known as COPD. So this is one of the most common lung diseases. It's a chronic condition that includes difficulty breathing. There's two main forms of COPD known as emphysema and chronic bronchitis. And it involves the airways in your lungs becoming inflamed and thickened. So the tissue where oxygen is exchanged is ultimately destroyed, and the flow of air in and out of your lungs decreases. When this happens, you in return get less oxygen into your body, and it becomes harder to get rid of that CO2. So the COPD estimates were higher among women compared to men across the years, and this is a graph that shows that. There are 3 risk factors associated with COPD. They are known as smoking, air pollution, and genetics. Smoking is the largest risk factor for COPD. It can increase your risks for developing this disease. What you breathe every day at work, home, and outside can play a role in developing COPD, as well as long-term exposure to air pollution, dust, chemicals, fumes, and secondhand smoke. And also, there's a very small percent of people that can have a rare form of COPD called alpha-1 deficiency. This is an inherited condition that affects the body. Unfortunately, with this deficiency, your body does not produce a protein known as alpha-1, which is responsible for protecting your lungs. And these are the signs and symptoms of COPD. So you may notice that you become more breathless than usual with your daily activities, such as walking to the car or showering. Your typical cough may increase in severity or frequently. You may notice a change in color of sputum from clear to colored. So any change in sputum or mucus production can be the first sign that you have an infection or an exacerbation. And an exacerbation is known as worsening or flare-up of your COPD symptoms, which is caused by an infection in the lungs or by inhaling irritating substances from the environment. So this will result in the airways narrowing from muscle tightness, swelling, and mucus. In figure 1, which I have on the screen, it displays a normal representation of the airways inside your lungs. And if you look at figure 2, it shows a person who is experiencing an exacerbation. And an exacerbation can cause some people to become extremely ill for several months. So it may take a little while for full recovery. Some other symptoms associated with COPD is low oxygen levels. So you do want to monitor your oxygen saturation by using a pulse oximeter daily. So to determine if you have COPD, your doctor may recommend a variety of tests and procedures. One of them on the top, known as pulmonary lung function tests. And these are helpful in diagnosing and determining the severity of your condition. It's a simple non-invasive test that is used to diagnose COPD. And this involves you to blow all the air out of your lungs into a mouthpiece connected to a machine known as a spirometer. The machine will determine and calculate the amount of air you blow out in the first second and the amount of air you completely blow out. There's also different types of imaging tests known as a chest X-ray, as well as a chest CT scan, which allows the physician to examine your lungs in much greater detail. And then finally, there's a lab test that we can do, and that's known as an ABG, which is also known as an arterial blood gas. And this test will measure how well your lungs are bringing oxygen into your body and removing that CO2, carbon dioxide gas. Tests are also used to monitor the progression of the disease. So you want to check if it also has helped to check if symptoms are under control and also to evaluate the effectiveness of treatment. COPD unfortunately cannot be cured. You can help relieve symptoms and slow the progression of the disease, but it can't reverse the damage done to your lungs. So detecting early signs of the exacerbation can prevent you from becoming ill. There are many ways to manage and live with COPD, such as medications, which I'll discuss shortly. You can attend pulmonary rehab programs. This program can teach you different breathing exercises and techniques that will help reduce your breathlessness and improve your ability to exercise. You'll also receive advice regarding proper nutrition during this program. Also, supplemental oxygen may need to be administered. If you have severe COPD with low oxygen saturation levels, using oxygen regularly at home and when you exercise may provide some relief. Many people use oxygen 24 hours a day. It's usually administered through a nasal cannula, which I have on the screen. And then, depending on the severity of your COPD, your doctor may suggest one or more different types of surgeries, one known as a lobectomy, and the second one would be a lung transplant. And that's a picture of pulmonary rehab. So there are a variety of ways to treat both asthma and COPD. Using medication is the first line of treatment, which is usually prescribed to anyone suffering from these diseases. Some medications include bronchodilators, and these drugs can help relieve coughing, shortness of breath, and trouble breathing by relaxing and opening constricted airways. There are two types of bronchodilators. There's short-acting and long-acting bronchodilators. So short-acting provides quick relief, lasting up to 4 hours in your system, and are most commonly prescribed to individuals suffering from asthma. A very common medication is called albuterol. Long-acting bronchodilators help treat COPD. These medications last several hours in your system, and they can work to relieve symptoms for up to 12 hours. An individual can also purchase a nebulizer, which is a device that provides or produces a fine mist of liquid medication. This liquid then gets inhaled deep into your lungs. Inhaled steroids may also be used in combination with the bronchodilator. This helps relieve inflammation. Finally, antibiotics may need to be prescribed. If you develop a bacterial infection like pneumonia, antibiotics are the first and most appropriate in order to fight the infection. But again, everyone reacts differently to medications, so it's important to follow your physician's recommendation and treatment plan. This may be one of the most important slides I go over today. It goes over basic inhaler administration and gives a visual of the proper technique when using your inhaler. There are many different types of inhalers on the market today, and it's so important to become familiar with the instructions for each particular inhaler that you are prescribed. Also, online resources as well as the packaging inserts are great tools to use. Okay, so there are several body changes that happen as you get older that may cause a decline in lung capacity. One of them being alveoli, which are also known as air sacs, that are deep inside your lungs can lose their shape and stretch. This ultimately leads to a decrease in your oxygen saturation level. Also, the diaphragm can over time become weaker, decreasing the ability to inhale and exhale. Your rib cage bones can become thinner and change shape, altering the rib cage so that it is less able to expand and contract while breathing. Another body change may include nerves in the airways that trigger coughing. They can become less sensitive to foreign particles. So when particles build up in the lungs, they can damage the lung tissue. And as you age, your immune system may weaken, leaving you more vulnerable to infections, such as pneumonia and different things like that. So in summary, it is so important to avoid exposure to pollutants that can damage your lungs. You must protect your lungs because they are so sensitive and crucial for survival. And I wanted to point out a couple tips to do so. So one of them would be live smoke-free, testing your home for radon, controlling humidity levels, keeping fuel burning appliances in good working order, ventilating your home and work area appropriately. Staying active, that's an important one. Getting regular exercise can help keep your muscles strong. And these are just a few of the examples to keep your body healthy.
Okay, great.
Oh, sorry.
Go ahead, please.
And then I just wanted to share a couple resources that we have at Valley Hospital. We have the smoking cessation program and the Better Breathers program. So the smoking cessation program is offered to those who have the desire to quit smoking or vaping. And the Better Breathers support group discusses living with different lung disease processes and how to manage them on a daily basis. I do coordinate both of the groups, so you can feel free to reach out for more information, but I wanted to thank everyone for joining me today. And if anyone has any questions, you can ask me.
Great. We're going to open it up to any comments or questions if anybody has any. Thank you so much, Jill. This was really interesting and comprehensive. If somebody is struggling with some breathing issues, they find, as they get older, perhaps it's seasonal or something different. Would you suggest they go to their primary physician first and ask for a pulmonologist pulmonology referral, or how would you, what would you suggest?
Right. So I would definitely contact first your primary physician, or even if they have a pulmonologist, I would speak directly to them.
Great. That's the good idea, just to check with
Hmm.
your primary
Right.
initially.
Hmm.
Excellent. Um, and additionally, somebody was asking a little bit about, have you seen any shifts since COVID? Any increases, any different types of complaints regarding lung issues?
In general, I would have to say we did see an uptake with lung conditions increasing, meaning we actually have in our pulmonary rehab program at Valley, we have a post-COVID program that is
Mhm.
combined. And I think we've been seeing a lot of post-COVID patients right after they recover, they still, going up a flight of steps, they still are having some trouble breathing. So we work with them together to try to get them back to themselves. But we do see, yes, I have to say
Mhm.
with COVID, we've seen an increasing amount of lung conditions.
Perhaps, thank you. Somebody is asking, are there any concerns with Euperin in my nebulizer? Does that make sense?
With what was it? Sorry.
Yuperlri.
Oh,
You,
is that there's a lot of different medications on the market today, especially, and
mm,
I'm not too sure with that specific medication,
okay,
to be honest.
okay. Oh, that's
Yeah.
right. And what exercises can a senior do to keep their chest muscles strong? Like, are there any particular exercises that you would
I would
suggest?
say, yeah, we usually recommend deep breathing exercise. Once in a while, take that deep breath, expand your lungs. Holding your breath can also help for a little bit, 5 to 10 seconds, if they're able to. But just, every once in a while, taking those deep breaths,
Mm,
helping bring that oxygen in and releasing CO2 will be, is efficient and will help with
great,
that gas exchange.
excellent. Somebody's asking if you're a former smoker, like
Mhm.
how long are your lungs affected? Is there a general answer for that?
Oh, yeah. So that one, that is a common question that I've been asked, and unfortunately, I don't have the answer to that.
Mhm.
I don't think there's really a way to know. Everybody's different, unfortunately. So
Just depends.
yeah, it depends on, right,
Mhm.
the person.
What has been your experience with asthma patients and COVID infections? Have they been more negatively affected?
I haven't seen too much of that. I will say our COPD patient population is more affected by COVID,
Okay.
meaning like long-term breathing issues down the line.
Okay. Let's see. And what impact do seasonal allergies have on these conditions? What
Season,
is your
hmm
general idea?
Yeah, seasonal allergies is one of the triggers for asthma.
Mhm.
So, if you think about any kind of allergy or anything you're breathing in, again, your lungs are so sensitive to us. Any little thing, um, we basically have little, it's called cilia that sweeps our lungs or the anything that goes inside. So we want to keep them as pure as possible. So, any type will affect it. So allergies is a big one that usually affects our breathing when we inhale different, springtime, really anytime now there's allergies, but
Yeah,
yeah.
great. And someone had asked about what can I do if my medications are making me hoarse and my
Hmm.
pulmonologist is aware of the situation? Is there anything?
Um, can you repeat that question one more time? I'm
What can I
sorry.
do if my medications, I guess for COPD, asthma,
Hmm.
are making me hoarse?
Um, I'm not
Mhm.
too familiar with that, but I will say some medications cause dryness. So staying hydrated or drinking lots of water, fluids getting into your body, can help.
Okay.
if that answers it.
And to your knowledge, are there any more recent updates on cigarettes versus vaping and their impact?
There hasn't been too much. We do understand that when quitting smoking, we don't quit with a vape device. So
Mm,
vaping is actually not just as bad, even worse than
mm.
smoking. So that, mhm.
Oh, so many young people are doing
I
that. It's so
know,
concerning. Oh my gosh.
right?
Okay, as we age, okay, sorry. As we age, oh, this is a good question. As we
Mhm.
age, many have increases in heart disease, specifically AFib. Are there any short-acting relief inhalers that affect heart rate less than others? In other words, the AFib and the inhalers, sometimes it can induce that. Do you know of any inhalers that
Right.
are less of a stimulant?
Not an inhaler, but I would definitely reach out to their pulmonologist.
Mhm,
They would be the best resource for medication wise and their condition, their heart condition. I know it's hard. They do have different inhalers. There's one medication nebulized
mhm.
Zopinex that doesn't have it
Right.
doesn't increase your heart rate, but that's a nebulizer. So I would definitely have
Talk to the
them,
physician, make
yeah.
sure. Yeah, absolutely.
Mhm.
And finally, how does aspiration during surgery affect your lungs?
So
You
as
you
yeah,
found?
that's a big one. Aspiration again, it's just having it can cause pneumonia. So again, um things that aren't supposed to go deep inside your lungs are, okay? It can
Mhm.
be anything, fluids, um, yeah, pretty much food, anything. So it can cause ultimately pneumonia, and that's the worry.
Okay. Um, Somebody had a question, I don't know if you can answer this,
Mhm.
about vocal cord dysfunction. Like how can reduce
Um,
instances of VCD or vocal cord dysfunction?
yeah, I would have
Yeah,
to research that a little more. I'm sorry.
no, that's okay. It's a little different than the actual topic. I think we're gonna close up now.